All right, so welcome to our last part of our 2019 booklet. This is hygiene. Hygiene, almighty hygiene. We all love hygiene, so it's going to be an interesting session as usual. All right. So we have a 38-year-old woman who works in a flax processing. Flax, that is people who are into clothing, let me put it that way, or textile fiber dust. These are the kind of people. So basically, I know you know what I mean. So she dries flax. She came to the hospital complaining of a difficult breathing, constricting sensation in her chest, and cough attacks. These signs appear on the first day of her working week and gradually diminish on the following days. What respiratory disease is likely to be in this case? So again, this is an occupational hazard. This is an occupational hazard. So definitely, that's what we're looking at. And people who deal with flax, they end up inhaling some of these fiber dust particles, or the flax, or the cotton particles, let me put it that way. So these people, they end up developing what we call bicynosis, basically. Bicynosis. They end up developing what? Bicynosis. That's what over here, your answer should be what? Should be C. Bicynosis. Okay. So this is actually an occupational asthma. All right. A district doctor has diagnosed one of his patients with dysentery. By now, you should know what dysentery is. Shigellosis. And you know it's a very severe kind of diarrhea, let me put it that way. So what accounting document reflects this type of morbidity? So I don't know what they mean by what accounting, blah, 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 but definitely with the option that we're having here, this person would need an urgent report, isn't it? Because if the diarrhea continues to go on, this person can even die out of dehydration. So urgent report is needed. Urgent report is needed or should be done. So your answer here should be A, urgent report. A 39-year-old man, a battery attendant. Battery. Again, people deal with battery. You should know that the substance inside the battery contains what we call lead, isn't it? So again, this could be an occupational hazard. So if it deals with this kind of stuff, you are likely to get AIDS intoxication, isn't it? So they said suddenly he developed weakness, loss of appetite, non-localized colicky abdominal pain, nausea. His skin is gray. There's pink-gray stripe on his gums. Stomach is soft and sharply painful. Guys, all that they're trying to tell us is that this person is having an intoxication of lead. Why? Because of the history of he being a battery. Definitely he works with it. So all of these things are all signs and symptoms of being intoxicated with lead. So over here we're having lead poisoning. So your answer is B, lead poisoning. All right. And normally it leads to iron deficiency anemia. So eventually it will lead to iron deficiency anemia. So please just take note of that. And again, the blood test showing the basophilic stripling. These are like kind of dots in red blood cells. They're like dots inside the red blood cells. And again, it goes on to confirm that there is lead poisoning. So your answer is B. A 9-month-old infant presents with a delayed tooth eruption. Guys, is this really therapy? Anyways, a 9-month-old infant presents with a delayed tooth eruption and fontanel closure. weakness and excessive sweating. What type of hypovitaminosis is most likely to be present? So definitely we're having, if they say there's delayed tooth eruption and fontanel closure, what comes to mind is calcium. What comes to mind is calcium, because calcium is very, very needed for the teeth and things like that. So when calcium is in low amount, then there'll be problem, isn't it? So over here, we are looking at what? Vitamin D deficiency. Vitamin D deficiency. Again, vitamin D or calcium is needed for what? Mineralization. So if it is low, then it will lead to bone diseases and stuff like that. And actually, the disease is called rickets. So just to add up. So here, we're looking at what? B. A 10-year-old girl exhibits high level of physical development, plus 3 sigma. I think we've done something about sigmas. Anyway, exhibit high level of physical development, plus 3 sigma. Her body length increased by 10 centimeters within a year, which is double the normal for her age group. Okay, so that means she's growing quite faster, isn't it? The number of permanent teeth corresponds with the age norm. Development of her sexual characteristics is 3 years ahead of her age. That means, again, she's growing very fast because 3 years ahead her age. Development of rate ahead of her biological age can occur due to what? So what they are trying to ask us is that anytime we are having this kind of growth like that, like growing faster than you should be, what plays a role in it, or what normally causes it? And of course, you and I know that this person could be producing a lot of what? The growth hormone, isn't it? Growth hormone. And if you talk about growth hormone, then we can definitely say that we are having a problem with what? Endocrine disorder or endocrine disorders. So that is what is causing all of these things to be happening. So irrespective of what hormone is causing it, we definitely know that it's what? Endocrine, because endocrine organs are responsible for producing what? Hormones. So we can definitely say we are having what? An endocrine disorder. So your answer here should be E. All right. Employees work in conditions of high dust concentration. High dust. Okay. So again, if this will be a disease, it will definitely be caused by what? The dust intoxication, isn't it? Now, certain chemical, silicon dioxide content to be specific, and physical properties of dust aerosol contribute to the development of occupational dust-induced diseases, of course. What is the main physiological property of dust aerosol? Now, aerosol is more or less like an air, okay? It's more or less like an air or something that is suspended in the atmosphere. So, the question now is, what is the physical property? So the physical property here we can talk about is that there is what? Dispersion, because dust particles are just suspended in the air, and that suspension, we call it dispersion. That suspension is called what? Dispersion. So here we're looking at what? At E. In the factory cafeteria, there was an outbreak of food poisoning. Clinical presentation indicates staff etiology. 15 people are sick. Now, to confirm the diagnosis of the food poisoning, samples need to be sent to the lab. What sample should be obtained for analysis? Guys, we're talking about what? Food over here, isn't it? So definitely you will need some content of the food to be able to test it, isn't it? And that's why over here, the right sample that can contain some amount of food would be what? Your vomit. will be vomit. So we can talk about what? Vomit masses. Vomit masses. Vomit. Because again, staph is also what? A foodborne what? Intoxication. I mean, staph poison is a foodborne intoxication. So for us to know the exotoxins and all kind of things, we need to do what? Analyze the food content. Analyze the food content. And we can get that from the vomit. When you vomit, part of the food will be seen or can be taken. So A should be your answer. A should be your answer. But of course, don't forget, you can also use what? Stool. You can also use stool. Let me just add it in. Add it. You can also use what? Stool. So you do a stool culture. You can do a stool culture. But don't forget, anything that you eat, it comes out as, as a stool. So you can also check that one too. But of course, stool is not present, but then vomit is there. So you can definitely go in for the vomit. All right. Now, in April, during the medical examination of various population groups, 27 individuals presented with a low working ability, rapid fatigability, that means gets tired easily. The following symptoms were observed in the affected individuals: swollen, friable gingiva, that is the gum, bleeds when pressed, hyperkeratosis follicularis, not accompanied by skin dryness. Now, these symptoms most likely result from the following pathology. Guys, we are definitely looking at a case of what? Scurvy over here, whereby there's what? Bleeding of gum and this and that and that. And you realize that sometimes when people are having the kind of bleeding of gums, we tell the person to go and take what? Vitamin C. Isn't it? We normally ask to go and take vitamin C because vitamin C helps in the connective tissue buildup. It's part of the connective tissue. It helps to build it up. The collagen fibers, whatever, it helps to build it up very well. So when all of these things are underperforming, then you can start seeing problems with it. You can start seeing what? Problems with it, whereby people are developing what? Anemia, because again, the easy tiredness or rapid fatigability could be as a result of the fact that there's what? Anemia what? Development. Anemia what? Development. So this person is definitely lacking what? Ascorbic acid. Ascorbic acid, which of course, it means vitamin C. Vitamin C. So when they come to you in your hospital, please prescribe to them what? Vitamin C. You can give them 200 milligram BD for the next 14 or 15 days. At least it will help. It will help. All right. So here, let's look at what? Vitamin C deficiency. So C hypovitaminosis. That should be your answer. All right. Increased general morbidity of the local population is observed in the area near a factory where atmosphere is being intensively polluted with sulfurous gas. What effect does polluted air have on the human body in this case? What effect does the polluted air have on the human body? So again, we are talking about a general disease that is occurring in a particular location. And they are telling us that there is a factory near these people. Okay. And this factory is producing what? A sulfur gas, which is polluting the atmosphere. So what effect does the polluted air is having on the human body? Now, I don't know, but for me, I would say this was a selective one. I mean, a specific, gas, because the question is specific that we are having a case of what? A sulfur gas that is being what? Polluted. I mean, that is being released into the what? Atmosphere. And this can affect the individual. The individual. So now, from that point of view, I can say we're having what? A specific, or can say we have what? A chronic non-specific kind of air pollution, isn't it? But then again, on the other side, they want to look at what the effects on the human body. Not the fact that there is a sulfur gas, but they want to know how the sulfur gas is having an effect on the human body. And so therefore, another food of thought is that this could be what? A non-specific kind of an effect, because you don't really know which part of the body exactly will be affected. Although we can say definitely, since a gas, the respiratory system will be affected, which in a way is specific, isn't it? In a way, it is specific. However, Krok is saying this is a non-specific, chronic non-specific. But I am of the view that it should have been specific because, one, we are having a particular kind of gas which is being released, and that gas is definitely going to affect the respiratory system, either the lungs and the heart, and that is specific effect on the body. But I stand to be corrected anyways. So if you know why Krok decided to go with chronic non-specific, please, you are welcome on board at the end of the presentation. Share your idea and let's think about it together. But for me, I have gone for non-specific. Specific. But this is E, so we go by it. All right. Now, during medical examination of high and middle school students, the doctor were assessing correlation. This is now a case of hygiene. The doctor were assessing correlation between biological and calendar age of the school student based on the following criteria. We have height growth rate per year, ossification of the carpal bones, the number of permanent teeth. What additional development criterion should be assessed at this age? Guys, we are talking about middle school students, high and middle school students. These are adolescents. So if they are adolescent, definitely you want to look at what? The development of secondary sexual characteristics. You want to look at that as a criterion to know how to do a proper correlation between their biological and the calendar age. So over here, we should go in for A, development of secondary sex characteristics or sexual characteristics. All right. Now, during analysis of morbidity, that is diseases in the city, it was determined that the age structure of the population, look at it, the age structure of the population is different in each district. But it's supposed to be the same. But you are saying that the age structure of the population is different. So what statistical method allows to exclude this factor so that it will not skew the morbidity data? And that is, when we did the hygiene, we said the method of making something to conform to a standard is called what? Standardization. The process of making something to conform to a standard is called what? Standardization. And that's over here. But that wasn't my time. Your answer is just A. All right. Clinical statistical investigation was performed to determine effectiveness of a new pharmacological preparation for patients with ischemic heart disease. What parametric test or coefficient can be used to estimate reliability of the result? You want to know reliability of the result. ladies and gentlemen, we've talked about this, whereby you want to estimate the population parameters when the sample size is small or when the population variance is unknown. When the population variance is what? Is unknown. And that is why we use what? The T distribution or the student's T distribution. We use that to determine that sort of what? Reliability. Because we don't know the sample size. We don't know the sample size. But we want to test and know if this drug is effective for people suffering from what? Ischemic heart disease. But we don't know the number of people that are having this kind of ischemic heart diseases. We don't know. So you are trying to estimate it with a sample size that is too small, or you don't know it. And we are not sure of the sample size. And again, we'll go in for what? For the students' T distribution. I think we did this thing the last time. So your answer here is D. In a rural health care area, there is an increasing cervical cancer morbidity. Cervical cancer diseases. The decision is made to conduct a medical examination of the women living in this locality. What type of medical examination will you do? What type of examination will you do? Now, don't go and say screening, because you do screening when you are not sure of the disease you are likely to get. I mean, that is prevailing in the community. So screening, you want to know if there's a disease, if there's hepatitis, if there's diabetes, if there is a hypertension. That is where we use what? Screening. But over here, we are having a specific morbidity, which is what? The cervical cancer. So we want to screen people. I won't say screen people, but we want to test people to see if they have this cervical cancer, which means that we'll not even be looking at the men, isn't it? Because men can't develop cervical cancer. No. So we are targeting what? The women. So this medical examination is called what? A target. Target. Why? Because we have an identifiable risk. An identifiable risk. And therefore, we do this test to screen the other groups which we think are likely to also have the disease. So this one is targeted. We are targeting a particular group of people. So your answer here should be what? Should be C. Should be C. In the process of hiring, a prospective employee has undergone a preventive medical examination and was declared fit to work in the manufacturing environment. What type of preventive medical examination was done? So it's just like you're going to look for a job. Then before you do the job, I must, interview you to see if you are the right person for the job or not. And that process is called what? Pre-employment test or preliminary test. Preliminary test. So again, we are having what? A D as our answer. Pre-employment or preliminary test. All right. On lab investigation of a pork, there is a one dead trachinella detected in 24 sessions. What should we do? This person, the food is infected. So definitely you should dispose the food. Don't continue to sell it or don't eat it. Dispose it technically, of course. So sent for technical disposal, because one trachinella in 24, is not good for us. It's not good for us. So we should send it. To assess the effectiveness of medical technologies and determine the power and the direction of their effect on the public health indicators. The research was conducted to study the immunization rate of children and measles incidence by the district. What method of statistical analysis should be applied in this case? So again, you want to conduct a study of immunization and measles incidents. And you know, when people are how do you call it, undergo vaccination or are going immunization, of course, the rate of incidence of measles will reduce, isn't it? So over here, you are trying to compare, and that method is called correlation coefficient. Correlation coefficient. So it measures the relationship between two variables. And again, you remember the last time we talked about it, that anytime there's correlation, it means there could be positive value, isn't it? No correlation will mean zero value or negative values, or inverse, that is opposite values. Then put that way. So over here, definitely we can have a positive value, because as long as people are undergoing vaccination or they are being are undergoing immunization, definitely the incidence of the measles will be decreased. So that's a positive correlation. Positive correlation. So over here, we are looking at at correlation coefficient. Correlation coefficient. Good. I love this. I think we've just discussed. So this is just a follow-up question. They are saying, having studied the relationship between the distance from villages to the local outpatient clinics and the frequency of visits to the clinics among the rural population of this area, it was determined that the rank correlation coefficient in this case equals to negative 0.9. How can this relationship be characterized, or how can you explain or interpret this correlation? Negative 0.9. And we said, if you have negative, it means inverse, isn't it? Now, if you have positive, it means direct or positive. Direct or positive. And it's negative, it is not negative or inverse. Or indirect. You can even say indirect. They all mean negative. Okay. But look at it. This is 0.9. That's almost like 1. And that is strong. Again, I was telling you guys about the strength. If it is around 5, this is like more or less like moderate, isn't it? If it is below 5, that is mild. If it's above, again, we are increasing the strength. So over here, we are definitely having an inverse relationship, which is very strong. So we have a strong inverse relationship, meaning the correlation is absolutely different. That's over here. We are looking at a strong inverse relationship. A strong inverse relationship. All right. In the inpatient gynecological unit, within a year, 6,500 women underwent treatment. They spent there a total of 102,000 bed days. What indicator of the gynecological unit work can be calculated based on these data? So now they've given you number of women that went for treatment. Okay. To be specific, maybe inpatient treatment. And because these people happen to stay on the bed or to sleep on the bed, isn't it? So now what indicator can we calculate from this? Definitely, we can calculate the average length of inpatient stay. The average length of inpatient stay, or how long people stayed in the hospital. Because now we have the population or the total number of people, then we have the beds that were used. So we can use that one to calculate how long people stayed in the hospital. And it is very, very necessary because the higher the number of days, the more money the hospital is supposed to get. Because every day you pay for the bed. I mean, those who have been working in the hospital, you know that staying in the hospital is not for free. You pay for it. So it's a way that management of a hospital get to know how much they are really earning. How much they are really earning. So yes, we can use this one to calculate it. So yeah, your answer should be what? Should be B. The average length or duration of inpatient stay. Inpatient stay. A middle school teacher with a 4-year-long record of work was issued a medical certificate for pregnancy and childbirth leave. What amount of pay will she receive for the duration of her leave in this case? Guys, we've already established that if you are sick or for some reasons you have to absent yourself from work, like pregnancy, you are allowed. It's part of your sick leave or whatever they normally call it. Okay, you are entitled to a specific number of days to be absent. And if not that, if you are sick, you are supposed to have days off, especially when the report is coming from the doctor. You are allowed, and they should pay you your full salary. Under no circumstance should you take part payment. You must take full salary because by law you are obliged or you are entitled to have some days off from work, especially when you are not feeling too well. And in this case, we are having it. So here, entitled to full salary. So your answer is 100% average salary. 100%. 100%. All right. In the air of the feed kitchen at a poultry factory, the area where formula feed is being mixed, the dust concentration reaches 200 mg per meter cube. Air microflora is represented predominantly by Aspergillus and Mucor fungi. What effect determines pathogenic property of the dust? Guys, you know these things. Aspergillus is, they cause allergies. So these are allergic kind of pathogens. Allergic kind of This is not teratogenic. This is not mutagenic. These two have to do with when you are pregnant, the chromosome changes is happening, or there's a physical defect that more of teratogenic physical defect due to being exposed to these things. But no, this is definitely an allergic reaction, or allergens. Let me put that way, allergens. So these are allergens. So they are potential for causing hypersensitivity reaction. They can cause hypersensitivity reaction. So over here, we're looking at allergenic. All right. During regular medical examination, a Lyceum student presents with signs of cheilitis that manifests as epithelial maceration in the area of lip seal. The lips are bright red with a single vertical cracks covered with a brown-red scabs. These clinical signs are most likely caused by insufficient content of the following in diet. Now, angular cheilitis. Angular cheilitis is usually as a result of nutritional deficiency. It's usually as a result of nutritional deficiency. To be specific, vitamin B2. Vitamin B2, how do you call it? Vitamin B2 deficiency. And vitamin B2 is same as Riboflavin. riboflavin. And it can lead to what? Anemia as well. It can lead to anemia. So over here, definitely we are having insufficient content of riboflavin or vitamin B2. Vitamin B2. Vitamin B2. Don't go into vitamin B1. Vitamin B1 is thiamine. But this is not vitamin B1. This is vitamin B2. B2. That is causing the angular cheilitis. Angular cheilitis. All right. So your answer here is what? Is C. Answer here is C. All right. A 30-year-old woman made an appointment with a family doctor for a scheduled vaccination of her 2-year-old child. What type of healthcare provides such medical services? This is what? Vaccination. So the person is not coming because the person is already sick. The person is coming to prevent the sickness from even occurring. And that is called primary healthcare or primary prevention. Primary prevention. In secondary, you have the disease, but you want to prevent complication. Isn't it? In tertiary, we are already having what? Complications. Okay. So the person is now in a rehabilitation center to prevent further things from happening or to prevent long-term disabilities. Good. So, I mean, we've done this, so I know it's not a problem for you guys. So this is primary healthcare. Primary. Human body receives from the atmosphere a number of chemicals. Okay. What type of action results in the combined effects that is less than the sum of isolated effects? So, what they're trying to tell us is that you have a lot of substances. Let's say A, B, C. This on its own can cause damages. That on its own can cause damages. This on its own can cause damages. However, when you combine them together, A plus B plus C, the effect is less or is minimal. What type of effect is that? What type of effect is that? So, usually, we have what we call antagonism. Antagonism. So, they are negating each other. Okay? They are negating each other. Now, if we talk about potentiating, it's either going to what? Increase or it's going to make the effect more rapid, or higher. Okay, that's potentiating. Okay, but this one here, we're talking about antagonism. Because you add all them together, their effect reduces. So they are against each other. The action of one is opposing the action of the other one, and so on and so forth. So that's why we are saying this word antagonism. So your answer should be E. Clinical trials have proven that Lipoflavon drug to be effective for treatment of unstable angina pectoris in the control group and experimental group of the patient. So we have a control group and then we have experimental group. Now, neither patient, now if you come to Ghana, you understand this better. Neither patient nor researchers knew who belonged to which group. So it's more or less we're having a control group, people without the disease, technically, okay? Or people without the disease, and people we are going to experiment the drug on them, okay? So these are the people that we are having, two set of people. Now, people who are doing research, okay, they want to know the effectiveness of the treatment or of the drug. So now they want to give it to people randomly. They want to give it to people to see if it will really work. And they are saying that these researchers do not have any idea who the control groups are or who the experimental groups are. They don't know. So let's say we are 50. Out of the 50, 10 people, 25 people are in the control groups, and 25 people are also in the what? The experimental groups. But we have mixed all of them together. So the person who is doing the analysis, the research, doesn't know who is who. So for him, when it comes, he's giving everybody, take it. That method of study or doing research or trying to analyze things, we call it a double blind study. Double blind study, whereby neither the participants nor the experimenters know who is receiving a particular treatment. They have no idea who is receiving a particular treatment. And this helps because it helps to know that, so that means that anybody at all can use it and perhaps to be effective on these people. But if we are concentrating on these people, our attention will be that, okay, these people are having the disease, so let's focus on them and make sure that they are well. So it can impede the test and the product that we want or the effect that we want, we might not get. We might not get. But if it is done randomly, the result is significant or magnificent. So over here, they do the double blind study, or that method is called double blind study. So your answer here is B. Your answer here is B. So basically, that is it. Your answer here is B.